Hi guys, welcome back to my channel. My name is Alicia Darleen for those of you that are new. For those of you that have been following my channel, know that I do these videos all about pregnancy. These videos in particular, I started at week 6 and I'm going all the way until I deliver. This video is going to be about week 31. Like I said, this is my second baby. I have a toddler at home and she is about 1.5 right now. So this is baby number 2. We're going all the way until I deliver with these videos, hopefully. Yeah, so please like and subscribe to my channel if you have not already. You can turn on that notification bell also, and you can get notified every single time I come out with a video, because I talk not only about my pregnancy journey, but just a whole bunch of other stuff about placenta encapsulation, what I think about it, what to pack in my hospital bag, when to start giving your toddler solid foods, kind of stuff like that. So if any of those interest you, you can check out my channel for more videos. So also, I am currently a stay-at-home mom. I do make a full-time income from home. I'm not just making little tiny commissions and a little bit of money here and there. I'm actually able to make a full income from home. So me and my husband both work from home. If you want to find out more information about how we're able to do that, you can click the link in the description below. That's going to be the very first link, and we can kind of talk to you about what we do and how we're able to stay home if you want more info about that. But let's get into week 31. Okay, so week 31, we are in our 3rd trimester, 7th month. We only have 2 more months to go. Baby is pretty big, about the size of a coconut. So about 16 inches long and about 3.2 pounds. So your baby is quickly approaching birth length, and your baby has pretty much a couple more pounds to still put on, whether that's like 2 to 5 more pounds that they still have to gain until they are ready for birth. So your baby's pupils can constrict and expand at this time. They can probably see the outline and shapes and light from just being in your uterus. If they open their eyes, they can kind of, like I said, see those shapes. If you're wondering what color baby's eyes are, you probably won't be able to tell until like 6 to 9 months after baby is born. They say if baby's eyes are greenish, bluish, or grayish, that they could turn into like those bright blue, those hazel, and those green eyes. But if baby's eyes are brown, it probably won't change. So for us, I'm hoping that baby number 2 gets my husband's bright green eyes. My toddler has my eyes, which are brown. Her eyes are still beautiful, but I'm hoping for baby number 2, we might get those really cool bright green eyes. But like I said, we won't know until baby's about 6 to 9 months old. So your baby can't smell right now, obviously, because they're in a big sack of amniotic fluid. They're not able to smell, but one of their favorite scents when they come out is going to be your amniotic fluid. It's going to be their favorite. They're going to love it, and they're going to recognize it when they come out. That special bond will also be through scent. So at this time, your baby's lungs and digestive system are continuing to develop. They're not fully developed yet, so just continuing to get stronger and more developed. Also, as you're in your 3rd trimester, baby may have turned head down. It's not a huge deal if they haven't turned yet, because there's still lots of time for them to turn. Some babies don't even turn until right before labor. This kind of was the reason that we had to have a C-section with our first. I don't mean to put that as anything bad. It's just that that's one of the reasons why we had to have one, is because our baby never turned head down. So hopefully, if you have gotten some ultrasound appointments in, they can check and see where baby's position is. But don't freak out yet if baby hasn't turned head down yet, because like I said, you still have plenty of time for baby to turn. Okay, so what is your baby doing all day? So pretty much they are sleeping, kicking, hiccuping, swallowing, breathing, and they can also suck on their thumb right now. So some babies suck on their thumb so much that when they're born, their little thumb is full of callus. So that's pretty cute that they're able to suck on their thumb, but just know that if they are doing it, that might be why their thumb is a little bit hard and full of callus when they are born. Okay, so let's talk about mama. So a lot is going on at week 31. Your abdomen is just growing. You may be experiencing more aches and pains because your abdomen is growing. So it's kind of just like this endless cycle of things. Your stomach is going to be going out So of course your back is going to be going in. Try to do those stretches, like just some pelvic stretches, some lower back stretches that can push your pelvic back out instead of going in to kind of help with those aches and pains. Another one is swelling legs. If you're dealing with swelling in your legs or your feet, it's a good idea to put your feet up, to lay on your left side, just to kind of help with that, to help reduce that swelling. Of course, heartburn is something that hasn't gone away since, you know, you became pregnant. So if you're dealing with heartburn, just know that the trigger foods, not to eat them, stay hydrated, and eat those small frequent meals. You might be dealing with leaking breasts. So if you are starting to leak colostrum, just know that that's pretty normal. It's just your body getting ready to breastfeed that little baby. So if you're noticing that they are leaking and getting onto your clothes, it's a good time to start practicing those nursing pads you can get. You can get the cloth or the disposable nursing pads so you don't, ruin your clothes. And continued hormone production, which pretty much means you could feel like crap, you are tired all the time, you're moody. I mean, it's just a whole bunch of stuff with pregnancy hormones that are, pretty relatively normal, just to feel crappy, in your third trimester, just because you are just gaining so much weight and getting more and more uncomfortable. But just hang in there, because you are so close. You're already made it past the first and the second trimester. All you got to do is just finish out the race and finish out the third trimester. So just make sure that your hospital bags are packed. I did do a video about what I personally packed in my hospital bag, so you can check that out. I went into what I packed for baby, and what I had my husband pack for himself. So our hospital bags are ready to go. You can check out that video. I can probably link it in the description below so you can check it out. And just make sure that you are drinking lots of water. Like I had mentioned, you just want to make sure that you are well hydrated, that you're feeling good, going into this week. Water also helps your body to cool itself down. So if it's something that you're kind of dealing with, like you're always hot, or if you're having like those hot flashes, just make sure that you are staying hydrated. So we will see you in the next video for week 32. I might do 32 and 33 together. So we'll see you in those next videos. Like I said, please like and subscribe, and we'll see you then.